Hi, in today's video we'll be talking about hypertension and how it affects the eyes. Now, what is hypertension? Hypertension means that there is increase in arterial blood pressure. How does it affect the eyes? It can cause hypertensive retinopathy in the eyes. Now, what is hypertensive retinopathy? In hypertensive retinopathy, when the blood pressure is high, it damages the small vessels in the retina. Thereby, it can cause them to get blocked, it can cause them to get leaky, it can cause them to take care, thereby leading to blurry vision, and then sometimes you see hemorrhages on the retina. Another thing is what we call retinal artery occlusion, which means blockage, that's retinal artery blockage. So this is trying to tell us that when the blood pressure has been high for a long time, the arteries on the retina will become stiff and sometimes it gets blocked. When the arteries are blocked, blood does not flow to the parts of the retina. This can cause sudden loss of vision in one eye or painless loss of vision in one eye. Then another one is what we call retinal vein occlusion, which means retinal vein blockage. So in retinal artery occlusion, it's affecting the arterial vessels of the retina, while in retinal vein occlusion is affecting the retinal vein. When the blood pressure is high, it causes the retina, it affects the veinal walls and it increases clot risk. When there is a clot or blockage on the vein, the blood flows back into the retina, thereby causing maybe sudden loss of vision or gradual blurry vision or sometimes vision loss. So that means the retinal veins are being blocked. And now is what we call optic neuropathy, which means damage of the optic nerve. In optic neuropathy, when the pressure is high, it prevents the supply of blood to the optic nerve. Now, this optic nerve is the cable that carries, it's the tiny cables, they are the cables that carry information to the brain. So when there is no blood supply to the optic nerve, it can cause loss of vision. My advice to hypertensive patients is always take your medication, manage stress, eat healthy food, check your BP regularly, limit intake of alcohol and avoid smoking, and protect your eyes. See you in my next video. Bye.